undesirable secondary effect, which occurs in addition to the desired therapeutic effect of a drug or medication. Side effects, they may vary for everyone depending on the individual patients. And today, Dr. Quinn's going to break it all down. He's going to tell you why you should really take your medicine if you need to. So, Dr. Quinn, have you had patients complain about side effects, and how do you just manage this problem? I'm sure you have had them complain.
Well, Tao, I had a conversation with a patient just earlier today. And basically, I asked the patient to just imagine every time that she gets in her car to go to work, because it's very important for her to go to work, does she wear a seatbelt? And she said she does. And I said, always just remember, when you put your seatbelt on, the reason you put it on is you realize that you could have an automobile accident on the way to work, but you still go to work because you know that it's so important that you get to work so you can make money to take care of your family and your responsibilities. When you take medication, it's the same thing. There's a possibility that you could have a side effect, like say an automobile accident when you drive a car, but you still drive a car, but you still need to take the medication, because if you take the medication, then you can get your blood pressure lowered if that's what it's for, and you have less of a chance of having a heart attack or a stroke or losing your life. So just like you take chances when you drive to work every day, you wear that seatbelt for safety, you take your medicine, and if you have any side effects, you talk to your doctor and let them know, and that's your safety, that conversation with your medical provider.
Absolutely. Now, are there scenarios where the side effects of medications can be considered optimal now?
Yes, there are. With our new classes of medications, the GLP-1s, and that's the glucagon-like peptide agonists, such as your Ozempic, your Mounjaro. These are medications that were initially prescribed for diabetes, but the side effect that was discovered while the medicine was in clinical trials was the fact that people lost their appetites, and as a result, they lost their weight and their diabetes was better controlled. They were happier because they wanted to lose weight, because a lot of these people were overweight, as is the case for a lot of people that have diabetes. So that's a positive side effect scenario of a medication that people are really, really happy with.
Okay, so in regards to potential side effects of medications, how do you advise your patients to make sure that they take them?
The first thing that I advise any patient to do is have a conversation with your medical provider when prescribed a medication, especially if it's a new medication to you. Ask them to go over what are the possible side effects, as that medical provider should do, so you'll be on the lookout and you'll know what to look for. And if you start having those side effects, contact your medical provider immediately if they're not considered just deadly. Like, for instance, you have chest pain, don't take the medicine anymore, go to the emergency room, but contact your medical provider so that he or she can advise you on what to do. In a lot of cases, we will change the medicine to a different class of the same medicine for the same action, and then we can control that blood pressure, that diabetes, without any side effects. So that communication is key.
Thank you so much, Dr. Quinn. That was a lot of good information. We appreciate your time as always. Right now, we're going to switch over to Gracie with Weather.
Thank you.